Hi, everybody. My name is Lauren Goldman, and up until very recently, I was the clinical nurse educator at BC CDC in the STI HIV clinic. And I've also worked in syphilis case management there for several years. And this morning, I'm going to be speaking about the challenges that we've experienced using traditional partner notification methods during this current syphilis epidemic, and about some of the more innovative and intensive interventions that we've adopted to increase the effectiveness of our partner notification process. And I have no conflicts of interest and nothing to disclose. That's what we're going to talk about today. So partner notification is a standard component of the public health response to sexually transmitted and bloodborne infections. Typically, this is a voluntary process that involves identifying the sexual partners of somebody who's been diagnosed with an infection, and in this case, syphilis. And the sexual partners might be contacted by the person who has syphilis, the index case, or by public health nurses. And the ultimate goal of this is to give this person information that they could use to so they know how to best take care of themselves, whether that's getting tested or tested and treated, if needed. And what we're finding is that in light of the characteristics of the recent syphilis epidemic, traditional partner notification strategies don't seem to be playing a major role in addressing the current rates of infection among gay, bisexual, and other men who have sex with men. And there are several factors that can make engaging in the partner notification process difficult or unappealing for people who've been diagnosed with syphilis. And I think firstly, one part of it is that the initial conversation between somebody who's been diagnosed with syphilis and a syphilis nurse, a lot of information is covered in that phone call. So at that time, and it can feel really overwhelming, and I think when you receive a lot of health information at once, it can be hard to remember everything that you talked about, even though it all made sense at the time. So when we call somebody, we'll often talk with them about their diagnosis, because syphilis, as Hasina mentioned, is staged differently depending on clinical presentation and past blood work. And people might have had a diagnosis several years ago and they needed this kind of treatment. Now it's a different stage. We're recommending a different treatment. That can be a little bit of a confusing thing that just needs to be worked out. We'll also talk about treatment. So people who've been diagnosed with syphilis before will often want to share their past experiences of being treated and what that was like for them. And for people who have not been treated before for syphilis, there's oftentimes lots of questions because they've heard about what that experience is like, and we want to give them as much information as possible so they can manage any sort of symptoms or discomfort they might have after their treatment. And of course, sometimes this conversation gets more involved if somebody is living in a remote part of BC, or if they tested in one area, but now they're traveling out of province or out of country. We're often working together to figure out how to best serve that person in terms of their treatment. A lot of people have questions about symptoms. So if they are experiencing a symptom, there's a lot of curiosity about when they can expect that symptom to resolve after treatment, particularly if it's perhaps like a rash somewhere that's on their body and it's visible, or if they're feeling quite nervous about neurological symptoms. We talk a lot about modes of transmission, and then we have often a very rich conversation around partner notification. And Olivia and I didn't meet or talk at all before today, but everything that you just discussed plays a huge role in the conversations around partner notification. So beyond the details of kind of going through how far back partner notification should go and who needs to be tested, who should be treated, in those conversations, there ends up being a lot of opportunity to talk about the things that might make partner notification particularly difficult for somebody. So that might be power dynamics in relationships or intimate partner violence. If one or both partners is living with mental health concerns, if a partner is incarcerated, if somebody has a new HIV diagnosis at the same time, all those things kind of play in together to make it not as straightforward as, okay, here's a list of people, get in touch with them and keep it simple. It's much more complicated than that. So while we are having this conversation, we're trying to make all this information available in as accessible a manner as possible. And throughout the conversation, we're always touching base to make sure that the person that we're speaking to understands what we're talking about. I think what we find is that in spite of how well that conversation goes, it's difficult to remember all that conversation after the fact. And in our follow-up calls with people who've been diagnosed with syphilis, we often find out, we call to touch base to see how the partner notification conversations went. A lot of people forgot the reasons why they should notify people going all the way back to last November, or they kind of forgot that it was important that some of their partners get treated and they didn't really think it was super important, or this person's test came back negative so they didn't need it in the end. Some people, after all that conversation, still are quite sure that they know who they acquired syphilis from, and so they don't really think they need to inform anybody prior to that time, or so a lot of different things. In spite of having this very rich conversation, it's a lot of information all at once, and it's hard to remember all of it. Other folks take on their partner notification. They're really happy. They start off with the best of intentions and find out that it's a lot of work, and that maybe it's emotionally draining, or they have so many other things that they're busy with in life that this is something that can easily end up being not on the top of the priority list. So other things that can make partner notification challenging for people is one big piece is a lot of folks have concern about the privacy of their friends or their lovers, and while they obviously have the best interests of those folks in mind, they also don't necessarily feel comfortable sharing their contact information with a public health nurse. One of the things that we find is that some people have limited knowledge about the different ways that syphilis can be transmitted. So as Hasina mentioned, it's easy to pass syphilis through oral, vaginal, or anal sex. And it's also possible to transmit syphilis when when skin comes into contact with a syphilis lesion. And that includes all the microlesions that can be present in a person's cheeks or in their mouth when they actively have an infection. So a lot of folks don't realize that it's possible to acquire or transmit syphilis even if they're using safer sex practices. And they also might not consider some of their partners to be at risk for syphilis because they only had oral sex, so that person probably didn't get syphilis, so I don't have to let them know. Stigma plays a huge part. Some literature shows that up to a third of people who are diagnosed with an STI don't feel comfortable telling their partners about it because they have fears, they're embarrassed, or they have fears for their personal safety or their reputation. And also the people who are least likely to be informed that they're a contact to an infection are casual partners and ex-partners. So if people are uncomfortable talking with their casual partners about being a contact to syphilis, that has huge implications for this community that's most affected by syphilis right now. And as Olivier mentioned, the social determinants of health and the intersections between various identities that people have can make it really difficult for people who are part of perhaps racialized minority groups or people who are doing sex work. They're experiencing multiple layers of stigma and discrimination that determine whether or not they feel safe doing their own partner notification or comfortable disclosing or even giving that information to a public health nurse to do that on their behalf. And the other thing that I think a lot of people are just exhausted from interacting with the public health nurses in the healthcare system. So when a routine screening is excellent and really important, and it also has some unique challenges in it, which means that once somebody is diagnosed and treated for syphilis, they become susceptible to acquiring the infection again. And this can lead to a cycle of ongoing incidents within a pool of individuals with high rates of reinfection. So subsequently, multiple people are getting syphilis multiple times, and they're having multiple interactions with the healthcare system each time. Many people don't just get diagnosed with syphilis once. They'll be diagnosed with syphilis multiple times, and also will also test positive for other STIs at various points in their life. So that means that's a lot of phone calls from the public health nurse, calling to ask them very personal questions about their sex life, their sexuality, and their sexual partners. And on top of that, if people have been named as contacts to syphilis by their lovers, or again, receiving anonymous phone calls from public health nurses,
it's a lot of phone calls. Some people feel harassed and aggravated by this. And if they haven't had positive health, if they've had any kind of negative interactions with nurses or healthcare system in general, it doesn't make it a very appealing thing to answer the phone when you see that number that you've saved in your phone as like the syphilis nurse calling. I know that people do that because they're like, okay, I know who you are and I'm not interested in talking to you, which is fair enough. And of course, a lot of folks identify that they have anonymous partners, so that's a number of people who we just can't support through the partner notification system. So what we found is that reaching the core group of gay, bisexual, and other men who have sex with men that are most at risk for syphilis infection, there's been a lot of challenges in this regard. And so what we've tried to do is find some innovative and also more intensive interventions that might make this partner notification more effective and therefore enhance the health of this community. So at BCCDC, one of the things that we do is we make multiple attempts to reach each index case and each person who's been named as a contact. So we don't just make one phone call and put it aside. We try to reach them 2 or 3 times, and we try to use different modalities to reach them. What we have started to do is what we're calling enhanced partner notification. So previously in the past, especially if somebody was testing at a site where they were very familiar with sexual health and they did a lot of sexual health screening and lots of diagnosing and treating for syphilis, we would just let that healthcare provider know, along with the diagnosis and treatment options, what the recommendations were for partner notification. And 9 times out of 10, we'd get back in touch with that nurse or that doctor, and they would say, I spoke with my client, they're happy to do the partner notification themselves. And we would just leave it at that. But what we're finding is that that hasn't been effective at affecting the infection rates. So what we're doing now is we're now contacting every single person who does test positive for syphilis, regardless of who they tested with. And during that phone call, we've kind of, historically we still do, but we've historically really influenced people's autonomy and respect for their privacy and let them know that under no circumstance are we going to boss them into sharing personal information with us. And we've kind of wanted to highlight that so that people know that they're having a respectful encounter with a nurse. We still do that now, and at the same time what we're trying to do is provide a lot more context about what's happening in syphilis in BC, and in particular like in the Lower Mainland area. Talking a lot about the epidemic and how we've been trying to do syphilis partner notification this way for many years and it hasn't been working. So now we're really strongly encouraging people to take us up on the opportunity to have a nurse contact people anonymously on their behalf. We talk about how the literature supports that as being we tend to see more positive outcomes for communities when public health nurses do the partner notification. And that there are a lot of benefits to the index in that particular case, because that means that folks who are in their sexual network are going to be getting the appropriate care they need and being encouraged to follow up on getting their treatment and supported through that process. Partners are getting benefits from that, and also from that comes just better community health. So, and then the other things that we've done is BCCDC has developed some email and texting guidelines. So we're now allowed to use different modalities to reach clients, both contacts and index cases. So we can reach clients that we previously weren't able to get in touch with over the telephone. And at the same time, the guidelines help us uphold the best practices around protecting people's privacy and confidentiality. And we've done a lot of work with public health nurses and different health authorities, both in terms of relationship building and doing lots of syphilis education sessions, particularly around rationales for which partners should be tested, which partners should be treated. And we've also worked with public health nurses and different health authorities to create procedures that help us to streamline our ability to collaboratively outreach to people who are particularly vulnerable and not easy to reach by phone or by text or by email. So, oh yeah, that's some more of the stuff. Oh, and we have Get Checked Online codes for, has anyone here heard of Get Checked Online through BC CDC? Great, so this is an online testing service where people can go in, fill out an assessment, and print off a requisition, take it to a lab for screening. So what we're doing now is we're providing people with codes if they've been named as a contact, so that they can go take care of this themselves and on their own schedule at a time that works for them if they can't match up with a clinic. And we're also building a platform for internet-based partner notification through the Smart Sex Resource website. And this is just a quick snapshot of what partner notification has looked like since we started doing this enhanced partner notification last fall, but since January until present, this is a quick snapshot of what it looks like. So of the 462 cases of infectious syphilis that have been diagnosed specifically among gay, bisexual, and other men who have sex with men, 350 of those individuals, we got in touch with them to talk about partner notification. And of those 350 people, 307 of them indicated that they had at least one notifiable partner. And of those 307 people, 87 of those individuals asked a syphilis nurse for help with some or all of their partner follow-up. And from those 87 index cases that we supported with their partner notification, we were asked to contact about 519 different partners. Yeah. So of those folks who we had a chance to talk with, there was a total of 1,289 notifiable partners identified, and 40% of those people were asked. We followed up on about 40% of those individuals. And Christine, sitting at the back, she put together all this data for us. So thank you. Yeah, and that's it for this presentation.